And welcome back to the Factor Uncensored. It's Prostate Cancer Awareness Month, and hopefully this is a wake-up call for any men watching who have been putting their health on the back burner. Now, the CDC says 13 out of every 100 men will be affected by prostate cancer, and 2 of the 3 of them will die from it. Black men are at a higher risk than many others. Researchers also say 1 in 6 black men are expected to develop the cancer in their lifetime. Scary to think about, but even more reason to stay on top of our screenings. Dr. Nathaniel Barnes from Memorial Hermann joins us now with some vital information for those who don't have the basics, like what is prostate cancer? Let's begin there, doctor.
So the prostate is an organ that sits right under the bladder, and your urinary channel goes through it. Think of it as a donut that sits under the bladder. Serves one function, that's to help in fertilization and propel the sperm towards its journey. After that, it can become inflamed, enlarged, and even cancerous. Prostate cancer is the #1 cancer in men in America. And black men, both in the U.S. and in the Caribbean, are at greater risk than anybody in the world.
Now, why is it such a risk for those of color, men of color, especially African Americans?
We think it's probably the racial milieu versus if you look at pure South African blacks, they have lesser risks than coloreds in South Africa who have racial mixture. So we think a lot has to do with the genetic mix.
And for those who have concerns, and many people are like, oh, I don't want to get my prostate checked. Right. So how do you convince those individuals with that masculinity running through them to go and get it checked?
So to be honest with you, we're veering away from annual digital rectal exams in favor of the PSA blood tests. It's a simple blood test, costs less than $100, and you get it drawn once a year. In the high-risk group, which would include all black men, we would start at age 40. If you have a first-degree relative, a father or brother, or if you've had a sister or mother who have BRCA-positive breast cancer or ovarian cancer history, we would start at age 40. Otherwise, we start at age 50 once a year until age 70.
Now, when we talk about that blood test, many people have not heard about it. For some, they're hearing about it for the first time. Is there an option when you go to your doctor and they tell you there's only the rectal or digital test? You can say, or can you say, absolutely, I want the blood test?
Absolutely. And actually, if you see a family practice doctor or an internist, their organization suggests that they shouldn't proceed with the test without having an informed discussion with the patient. So patients need to go armed, and particularly the wives of these men, to the office with the agenda that I'm going to ask for the PSA blood test. And ask for it, tell them that you're informed of it, you've done your research, and get the blood test. It can be life-saving.
Now, if you haven't done the test and you find out you have prostate cancer, what kind of symptoms are you looking at, and is it life-threatening? Obviously, we know it's life-threatening, but is there any way to stop it or to treat it once you realize you have it?
The good thing about prostate cancer is it doesn't have symptoms early in the disease, only in the last year of life, and it's a slow-growing cancer. However, the bad thing is it doesn't have symptoms, so you have to be screened. The men who show up with symptoms generally have bone pain, typically back pain or hip pain, and by that time it's metastatic disease. Wow. It is not curable, as most cancers aren't, once it's metastatic.
All right, Dr. Barnes, thank you for joining us and that valuable, and thank you for telling us about the blood test. Finally, so we all don't have to do, we got you.
Thank you.
Thank you, sir. Just hold on a second,